Dana. I'm a registered nurse here. I just finished washing my hands. That is the best way to prevent the spread of infection. How are you doing today?
Good.
Good. And can you state your name and date of birth?
Garrett Schaefer, 21779.
You have any drug allergies?
No.
Okay. It looks like we're just going to be doing a full head to toe assessment. Probably take about 25 minutes or so. Are you okay with that?
Mm-hmm.
All right. We respect your privacy around here, so I'll pull the curtain, and we won't share any of your personal information. We took your vital signs just a few minutes ago, and your blood pressure was 135/82. Your heart rate was 86. Your respirations were 18, and your pulse ox level was 98. So, and your temp was 98.6. So all of those are fine for you. We will go ahead and get started with the cranial nerves. So we'll start with the first one, which is the olfactory, and that tests your nose and your smell. So what I'm going to look at is that your nose is midline to your face and it's not deviated to any one direction. And if you will just hold your left nostril and then sniff through the right one and then switch sides. Okay, so it appears that your nares are patent. No foreign bodies or lesions are noted there. I'm going to have you close your eyes and see if you can smell this object and tell me what you smell.
Peppermint. Sorry.
Is there something funny, Mr. Schaefer?
Yeah, it tickled my nose.
Okay, I'm sorry about that. All right, so olfactory cranial nerve is intact. Next, we would test the optic nerve, which is the Snellen. We would use the Snellen eye chart, and that is the eye chart that you're used to seeing in the eye doctor. It's placed usually 20 feet away, and you try to read the smallest line possible. You cover your left eye, and then your right eye, and then uncover both eyes, and you read as far down on this chart as you can go. If you have glasses and contacts, the only time that you would need to remove those is if you have if you're nearsighted, extremely nearsighted, or have an astigmatism. So we don't have a Snellen chart, so we'll just pretend that we did that, and that optic nerve number 2 is intact. And then 3, 4, and 6 are the oculomotor, trochlear, and abducens. And with that, I would be testing your extraocular movements and testing for light and accommodation. So if you will, Mr. Schaefer, just follow my pen with your eyes only. Okay, and then I'm going to just move my finger in towards your eyes, and I'm looking to see if your pupils do near and far accommodation, and they do. And then I'm going to just check your pupil size. They appear to be about 3 millimeters, and they both accommodate with light. And they're equally round. The sclera and in both eyes are clear, and there's no lesions, and both eyes are equal bilaterally. If I had an ophthalmoscope, I would be looking at the fundus of his eye, and that's just a way to look deep into the eye with a light, which is another way to look at it without having to actually dilate the eye. But we don't have that, so we'll move on. We tested the 6 cardinal gazes of field gazes, and the oculomotor, trochlear, and abducens cranial nerves are intact. Next, we would check the trigeminal nerve, which tests the sensation of the face. And I'm going to ask him to close his eyes and tell me where he feels me touch his face.
Left forehead.
Okay.
Right cheek.
All right. Thank you very much. I would also palpate his temporal muscles and masseter, and while he clenches his teeth. Temporal and masseter. Okay. Let me see you clench your teeth. All right. and they were nice and strong bilaterally. And he was able to name the places that I touched his face, so the trigeminal nerve is intact. We would also test the facial nerve, which is just looking for symmetrical smile and to test for facial drooping. Big smile, Mr. Schaefer. Okay, and everything is symmetrical and no drooping is noted to his face. So that facial nerve is intact. We had also checked the auditory or acoustic cranial nerve. If I had an otoscope, I would look in his eyes and I would be able to visualize the tympanic membrane. I'm also looking for excess wax or foreign bodies, lesions, none of which are noted. And I'm pulling the auricle up and back. There's his tragus, all that's intact and equal bilaterally. No piercings are noted. Instant recoil of both ears. I'll also take my pen and check the tip of his ears to the corner of his eyes to make sure that the palpebral fissures are even, and they are bilaterally. And then next I'm going to have him cover his left ear, and I'm going to whisper a word and to see if he can hear me from about 2 feet away.
Baseball.
All right.
Soccer.
Okay. And then if I had a tuning fork, I would use a tuning fork to conduct the Ryan and Weber test. I'm going to use a candy cane because that's what I have available. And the Ryan test would be placed right around here on his ear, and then the Weber, using the same tool, would be placed on the top of his head. And those both use vibration to determine whether it compares the Ryan test compares air and bone conduction, and the Weber test compares conductive and neurosensory conduction. It can also indicate conditions such as wax impaction or nerve deafness or middle ear fluid. Okay, moving on to the glossopharyngeal, vagus and hypoglossic nerves, which are 9, 10, and 11. I would be looking at the uvula. So, Mr. Schaefer, I'm pretending that I have a tongue depressor, and I'm looking and say, ah, and I'm seeing the uvula move up with the vibration of the ah. Looking at his lips, they are pink and moist. Smile for me. All right, open, stick your tongue out. All right, so the dorsal surface of the tongue is rough and has white papillae on it. Lift your tongue up, sir. And the ventral side is shining and vascular. Saliva is present. Open again. Let me see those teeth. His gums are pink, moist, no retractions. The gingiva look good, and I don't see any loose or missing teeth. Let's see. Oh, let me check the tonsils. Say ah again. Okay, and +2 on the tonsils bilaterally. His tongue was midline when he stuck it out. It did not deviate. And let's see, he was able to swallow that drink that he just took. So 9, 10, and 11, as I just stated, the names are all intact. And then we'll test the spinal accessory nerve, which we'll do the shrug test for that. So if you will, shrug your shoulders for me. And against resistance. Okay, and then I'm going to have you turn your neck this way. Turn the other way. All right, now do against resistance. And then again. Okay, good. All right, so the trapezius and the sternocleidomastoid muscles are strong symmetrically. I didn't hear any crepitus, and while I'm here, I'll go ahead and check the lymph nodes. So we have the pre-auricular, the post-auricular, submandibular, submental, occipital, subclavicular right here. You've got the supracervical, posterior cervical, and deep cervical on both sides. And then you could also check the axillary lymph nodes and the inguinal, which are down here. None of which of those were palpable. He also had, go ahead and flex your neck in and then back. So flexion and extension of his neck, and then he had already rotated side to side, so full range of motion with his neck. That concluded all of the cranial nerves. And then as far as the head goes, we've got a normal cephalic skull here. It's round, symmetrical. He's got brown, straight, kind of textured curly hair, I guess, with some gray noted there. It's kind of oily. No parasites or lesions are noted though, and it's evenly distributed. And then he's got eyebrows, which are evenly distributed with hair. He's got facial hair, it's the same on both sides. And he's got eyelashes on the upper and lower lids, which are everted and evenly distributed. His skin on his face is warm and dry, kind of oily, but warm, and the color is the same throughout. And the same thing with his neck. Right here, while I'm by the neck, I'll go ahead and listen at his carotid arteries, which if you lift up, I can feel there, and it's nice and strong, probably like a +2 bilaterally, and you always want to feel those one at a time. And I'll listen with the bell of my stethoscope. Okay, hold your breath for me. Listening for bruits. Okay, and none were noted. If I did note a bruit, that could be evidence of stenosis or turbulent blood flow, and that could be consistent with a stroke or carotid artery disease. And none of that was noted there. We did the face, the nose, midline mouth, midline no drooping. We've looked at the eyes, and he does not wear glasses or contacts. All of the cranial nerves regarding the eyes were intact. There was no nystagmus noted with the cardinal fields of gaze test. Ears are same level, symmetrical with the palpebral fissures. And there was no tenderness, was there, when I touched here and here? Okay. Sinuses. Let me go ahead and tap here. And this is the frontal sinuses. Anything? Tenderness? No. And maxillary? Any tenderness there? Okay. Let's see. The pharynx. We already looked at that. It's +2 on the tonsils. The uvula was midline. Looked at the neck, lymph nodes, nails. Let me look at your nails here. It looks like they're concave, and we have less than 3 capillary refill. Nice and rapid there. Even hair distribution. The skin is nice and dry and warm bilaterally. The nails are trimmed, translucent, and less than 160-degree angle. Then I would probably go ahead and move on to the thorax and the lungs. Mr. Schaefer, can I just raise your shirt to look at your skin? All right.
You need to stand up.
Yeah, that's fine. Okay. The skin, feeling with the back of my hand, nice and dry. The color is consistent throughout, and the hair distribution And I don't see any kind of vascular lesions or anything like that. All right, you can sit down now. It looks like the anterior to posterior diameter is 1 to 2, just as it should be. Let me go ahead and listen. Every time you feel my stethoscope, just take a deep breath. Okay. So the anterior chest breath sounds were clear to auscultation with no adventitious sounds. Vesicular breath sounds were noted throughout all fields. And now I'll listen to the posterior. Same thing, Mr. Schaefer. Deep breath. And again. Again. And then lateral breath. Okay, good. Okay, posterior lung sounds were clear to auscultation. Vesicular breath sounds were noted, and no adventitious sounds. I'm going to place my fingers here, and I want you to take a deep breath in and then out. Okay, and the chest rises and falls equally. I'll do some percussion here, and Mr. Schaefer, you don't have to do anything for this, okay? Okay, and all sounds are resonant there. Any pain or tenderness at all?
No.
No lumps are noted here. Okay. All right, and then I will also note that the inspiration was greater than the expiration on the deep breaths. Just checking the turgor under the clavicle here, and it's brisk recoil there. All right, and then I'll listen to the heart. I've already done the carotid artery. Listening with the diaphragm first. And then with the bell. Okay. No murmurs were noted there. No pulsations or heaves, which we'll look again when we lay him supine in the tangible lighting. Just to confirm that, no PMI is noted at the apex of the heart. There's nothing palpable there. So right here we had the aortic valve, which is the second intercostal space to the right of the sternal border. And then over here is the pulmonic, which is the second intercostal space to the left of the sternal border. And then under that is the Erb's point, which is found at the third intercostal space, which is left of the sternal border. And then we've got the mitral valve, which is found at the fifth intercostal space, left of the sternal border. And then just over from that is the tricuspid, or the mitral. I think I mixed them up. Tricuspid was there, and then the mitral is fifth intercostal space to the midclavicular line. Your S2 sounds are heard, are most accented at the aortic and pulmonic Erb's point. S1 and S2 are equally heard, and then your tricuspid and your mitral are heard. S1 sounds are heard better in those points. All right, let me since I've done the nails, let me do the toenails real fast. I'm sorry, we have a service dog in the clinic today, and he is just friendly with everyone. All right, so I'm looking bilaterally at your lower extremities, and there's no edema noted. Even hair distribution, the color is uniform with the rest of the body. I'm just checking your capillary refill, and it's it's greater than 3, excuse me. Sir, it's not going anywhere. And his feet are nice and warm with no redness. And again, capillary refill, nice and brisk. Okay, all right. I'll go ahead and feel your pulses. We already did the carotid. Right here is going to be your brachial. And I would check that bilaterally right there. And then our radial is right here. And they're both nice and strong bilaterally. Under here, under each knee is the popliteal. Nice and strong bilaterally. And then down here we've got the posterior tibial and the dorsalis pedis. Nice and strong. And right side, I think I did the popliteal, posterior tibial, and dorsalis pedis. And all pulses are +2, strong bilaterally. Okay. I'll verbalize the breast. Men need to know it's important to do self-breast exam, just like a woman, even though they're not as high risk as a female would be. But the 3 positions you could do that. You could do it sitting, you could do it hands on the hips, or you can do it leaning forward. And I would be looking for retractions, dimples, squeeze the nipple, check for discharge. Look for striae, anything that looks abnormal, lumps or tenderness or pain. In different motions, you can do a circular motion, spokes on a wheel, or vertical strips. And it's important to do those once a month. Let's see. Go ahead and we'll do our rapid alternating movement test. So Mr. Schaefer, I would like for you to take your hands and do like that as fast as you can. Okay, that's good. And then do your fingers like this. And then the other side. Okay, that's good. I want to do the heel to shin test on you. So if you'll take your heel, your right heel, and run it from your knee all the way down to the ankle, and then switch sides. All right, that's good. And then close your eyes. We've already done some 1 to 2 point discrimination. This will be, another form of testing. Can you just I'm going to trace a number in your hand, and can you tell me what number that is?
8.
Yep. And this side.
7.
Okay, good deal. So we've done 1 and 2 point discrimination earlier with the paper clip, and we've also done some light touch proprioception. Can I assess your gait, Mr. Schaefer? Would you get up and walk? So his gait is steady. Okay, and then can you do in front of toe? Okay, and can you walk on your tiptoes? Okay, can you bend a knee in? And then the other way. All right, and then while you're standing, go ahead and close your eyes, and we're going to see if you can stand there without swaying or anything for about 30 seconds. And you're good. We'll pretend 30 seconds has passed. And then I'm going to have you follow my fingers. This is called finger to nose testing. So follow my finger with your finger. Like everywhere I move it, touch with your index finger. Okay, good deal. All right, we'll test muscle strength now. So can I get the dog a little bit out of the way here. And I want you to squeeze my fingers. Okay. And then I want to test your muscle strength. So try to go against me here. And there. And then there. There. And let's do the feet. Up. Okay. Other way. Okay. All right. So, let's see. Let me have you do what you kind of just did whenever you did the strength testing, but let me have you flex your foot down or extend and then up. Okay, good. And then the other side. Okay. All right. Spread your toes for me. Okay, and then do inversion with your ankles. And eversion is out. Okay. Shoulders. Up, up, down. And then do the other side. Okay, that's good. Spread your fingers and in eversion, and then rotate your thumbs. Okay, and then your wrist, flexion, extension, inversion, eversion. Well, maybe we just did that one, I don't remember. Okay, and then pronation is like this, and supination is like that. Perfect. All right. Let me have you go ahead and stand up. We're going to do a couple of tests on your hips. So go up with your foot or your leg, and then the other side, and then come to the side with it, and then the other side, and then can you bring it in, and then other side. Okay, good. Now you can go ahead and lay down on your back. I'm going to do some more inspection of your stomach. All right, and so I'm going to lift your shirt up, Mr. Schaefer. And I've already felt the skin, and it's dry and warm to touch, no redness, no lesions. And I'm going to first palpate the abdomen for any tenderness or swelling, pain, any of that, sir? Mm-mm. Okay. And I would look to see if there was any heaves or PMI that I meant to check earlier. And there's not, or peristalsis, and I don't see that. I'm going to take my stethoscope and I'm going to listen in all 4 quadrants. And what I should hear is vowel sounds, at least 5 to 30 vowel sounds in 1 minute. And I'm listening in all 4 quadrants. And your vowel sounds are active. And then I'll name an organ in each of the 4 quadrants. Up here we could say the gallbladder or liver. Over here could be the stomach. Here could be the right kidney, or right ureter, and the left ureter. Go ahead and get you to, and your umbilicus is inverted, and there's a scar right there that I note. Get you to come on up. Your stomach was nice, flat, convex, round, and non-tender. Did you have any questions for me today?
No, ma'am.
Okay. Well, I will get your lab work sent off, and if there's anything that you need to know, we'll just contact you over the phone. Thank you for your time today.
Thank you.